So, good evening and welcome. My name is Elaine Vivens. I am the coordinator for the Children's Oral Health Coalition. We are excited to have you here today to be a part of our Growing Healthy Kids from Pregnancy and Beyond, What Nobody Tells You. Today is our fourth session on Community Resources Part 2. We have a dynamic group of panelists who will share information on the different types of childcare available. That's registered home, childcare centers, etc., quality of care during COVID-19, tips for choosing quality childcare, early Head Start eligibility and locations, Texas Rising Star quality, CCMS financial assistance available, services and supports for developmental delays, WIC services and eligibility, and a tool to help locate food, housing, transportation, and other much needed resources in the community, and usually I'm going to say in your neighborhood or close to you in Tarrant County and the surrounding areas. But first, I just kind of want to give you a brief information about the Children's Oral Health Coalition. The coalition was started in 1999, and our mission is to improve the oral health of children in Tarrant County through community collaboration. And we do that with the help of over 50 coalition members. Our target population is birth through third grade in Tarrant County and the surrounding areas. We also reach out to pregnant teens and women because we want to go upstream and get that baby and make sure the health of mom and baby is good. We have 4 focus areas, and they are awareness, prevention, education, and advocacy. And each of the boxes you see here, it shares a little bit of information about what we do. So in awareness, we create oral health messages, and so example would be catch a cavity. We do education awareness around that because a lot of people do not realize that you can catch a cavity from just kissing, blowing on a cake, just those simple little kissing the baby hand ways. We also do nutrition awareness, drink more water, and we also have a 5210 Slim card to talk to the pregnant teen and women about their infant and toddlers. For prevention, we have a school screening committee that is comprised of 5 coalition members, and they do school-based screenings. We also do screenings of pregnant teens in schools. We started, well, I almost said this year, but we started in 2019, maybe 2020, that we did screenings for Arlington ISD, and we eventually want to be able to get in and do Fort Worth ISD. We also have what we called our Wild About Smiles Kid Assembly event. That is a huge event for us. We assemble over 30,000 oral health kits with the help of about 150 volunteers. Those kits are assembled and then distributed back out in the community to schools and different organizations working with children. When we do education as a focus area, we have what we call our Train the Trainer for community professionals. So that's nurses, doctors, childcare providers, anybody that's working with families or have access to families in the community, including dental professionals. They go through a training. It used to be 4 hours. Now it's two 2-hour trainings that was taught by our Dr. Fuqua, our in-house dental expert. We also do education with medical dental providers through our Ask the Docs. Ask the Docs is a series of conversations we have that we're bringing the medical and dental together to bridge the gap during pregnancy for teens and women. And then we also do virtual parent education like what you're attending today. And we also have what we call oral health ambassadors, who are individuals that have attended Train the Trainer, and now they are going back to their organization to provide that training to the families they serve. From an advocacy standpoint, we believe that change begins at the organizational level. So when they come to train the trainer, they take that back to their organization, and then they're in a better position to advocate and share that at their organizational level. We also do access to care, access to coverage, and our Coordinated Care for Pregnant Teens initiative is an example of that, where we bring the medical and dental providers together, because what we were hearing is that a lot of pregnant teens and women were not getting access to care early enough during pregnancy, especially for the women who only have limited exposure to dental care when they're pregnant with Medicaid. So on that note, that's a little bit about the Children's Oral Health Coalition. Let's get busy now with our panelists and our moderator. So I'm going to start with the panelists. Our panelist today is Patrick Sanders, who's with Childcare Associates. We also have Tanya Swinford and Lennis Downley with CCMS. We have Michelle Cummings with WIC, Tarrant County Public Health WIC. We have Faith Rivera with Help Me Grow North Texas. And we have Ms. Frances Wampler with the Center for Children's Health. We are actually coworkers. And then we have Ms. Jerletha McDonald as our moderator. Jerletha is the founder and CEO of Arlington DFW Child Care Professional Association. Jerletha is also a member of the coalition, as well as a strong advocate for children and all things child care. Jerletha, thank you for joining us today. Thank you to our panelists for joining us today. But I would like to ask you, Jerletha, will you tell us a little bit about your organization and the role it has in the child care field?
Yes, hello everyone. Like she said, my name is Jerletha McDonald, and I'm the founder and CEO of Arlington DFW Family Child Care Network, formerly known as Arlington DFW Child Care Association. And what ADFW is, it's a professional network for family child care providers based out of Arlington in the Dallas-Fort Worth Metroplex. We provide monthly professional development services on business practices, child development courses, social and emotional development courses, and we also partner with some of the agencies on here to provide professional development for our providers in our network. We also, most of all, we provide business support systems for family child care professionals in the Dallas-Fort Worth Metroplex. Center directors and owners are welcome to join us. We have a yearly conference, and we provide a lot of community outreach services programs and stuff like that for providers. Advocacy and leadership development skills for family child care providers in the Dallas-Fort Worth Metroplex. And we also partner with our friends at Cook's Children at the Oral Health Coalition, where we get all our dental and oral health needs met for our children. And every year, I would like to say thank you so much, Elaine, for providing our dental health kits. Providers in our network look forward to that, and we base our monthly curriculum around it in around February for Dental Health Month. So thank you so much.
You're welcome. Thank you. So you now have it. So
yes,
I'll go ahead.
And so, as Ms. Elaine stated, I am your moderator tonight. And before we get started, I just want to go over what is quality childcare and how could you find quality childcare, especially in the Dallas-Fort Worth Metroplex. Well, quality childcare is when the childcare provider, owner, director, or family home center goes above and beyond for her families or the families that they serve, making sure that we are in compliance with ratio. And in the state of Texas, we have something called minimum standards. And that's just what that is, minimum standards. But quality childcare centers go above and beyond that. Most of our centers, and especially in my network, are TRS centers. We're going to probably talk about that later on in the presentation, where they go above and beyond, and they get services from coaches, and they get extra professional development, and they go above and beyond what state require us to have. Making sure that we have the health and safety practices are in place, and making sure that everything is in compliance, that are developmentally appropriate. You may hear DAP, that means developmentally appropriate practices. Making sure that we are providing activities and services in our centers that are developmentally appropriate for the age group that we are serving. And also providing stellar and excellent customer service, because the child and parent are our customers, and making sure that we are providing high quality childcare at all times. And so that's what quality is, and just making sure that we go above and beyond. And right now, we're in COVID, right? We're doing the COVID pandemic. Most of all providers that I know are still practicing, COVID guidelines from the CDC and what our state and local city ordinance are requiring, meaning that we're making sure that we wear masks, making sure that the parents who enter our center and anybody that visits our center are wearing masks, and making sure that proper protocols are being taken. Some even going to some centers that I know are going as far as purchasing these sanitation kits, like when you walk through this little thing and they're getting sanitized on their way in there. I don't know what that's called, but I've seen that in a couple of centers. But making sure that we are practicing sanitation guidelines per CDC and what our state is requiring of us. So basically, that's what quality care is. And also in the state of Texas, when searching for childcare, it's important to search for regulated childcare. And what regulated childcare is that we are regulated by the state of Texas, and we all have a certificate saying that, meaning we have a state number, and you can find us on the Childcare Regulations website. And what that is Childcare Regulations. You can look that up and go on our website, and you can search the childcare's name, right? And that name should pop up. Anybody in the state of Texas who is registered is on there. And what I mean by that is, in the state of Texas, we have registered providers, we have registered homes, I should say, licensed homes, and center-based care, right? Registered and licensed home is care that is done, care and early childhood education that is done from the provider's home in a certain area that is regulated by the state of Texas. And also, in center-based care, it's the same thing. It's a brick and mortar somewhere. It could be on a storefront. It could be a standalone building where childcare is performed, and those sites are regulated too, meaning someone from the state of Texas from Childcare Regulations comes out and monitor us. That is regulated care. It is so important for parents to choose regulated care, because we are monitored by the state of Texas. And if you are on another program, you are monitored by that as well. And so that's why it's important. And you can go to the Childcare Regulations website, search us, and also Best Place for Working Parents as well. Best Place for Kids has a site to where you can go on and search for regulated childcare in the Dallas-Fort Worth Metroplex and all over the state of Texas. And now that I have given you some basic information, let's chat with our panelists to learn more about the resources and services they provide. Panelists, thank you for joining us today. Each of you will have 4 to 5 minutes to share information about your organization, services, resources provided, eligibility requirements, service area, financial assistance provided, if any, and key information to share with a provider. Participants are encouraged to drop questions or comments in the chat box. Our first panelist is Patrick Sanders, Head Start Managing Director of CCA, who will talk about early Head Start and Head Start. Patrick, you have the floor.
Good afternoon, everyone. Again, thank you guys for having me on the panel. Can you hear me?
Yes.
Okay, thank you guys for having me on the panel. And we want to thank Cook's Children for hosting this event. And then we also want to thank you for the many things that you do at CCA and making sure that all of our kids' are dental needs are being met. So again, thank you. This evening, I am going to talk about the childcare side of Childcare Associates. Here in Tarrant County, Childcare Associates holds one of the Head Start grants that is awarded to Tarrant County. And so again, I am going to talk about Childcare Associates. We are one of the grantees here that is in Tarrant County. Tarrant County is one of the lucky counties to have over 2,000 kids amongst both programs being served through Head Start. So what is Head Start? Head Start is a national comprehensive child development services program for America's low-income preschool children. It promotes school readiness by enhancing the social and cognitive development of children through the provision of educational, health, nutrition, social, emotional development, physical, mental health, and other services. This program engages parents in their children's learning and help families in making progress toward their educational literacy and employment goals. Here at Childcare Associates, we offer three program options of Head Start. One is the Head Start program, which is for children 3 to 5. Then we have the Head Start option, early Head Start option, which is for kids 0 to 3. Within that early Head Start option, it is center-based. We have the 0 to 3 center-based. Then we have the 0 to 3 home-based. Within that home-based program, we also have what we call the STEP program, and that's where we work with the expectant families. Now go back with the 3 to 5 program. That is in person. We also partner with many school districts, and I'll show you in a minute kind of a map in the school district that we partner with. And then in the home base, in the Head Start, early Head Start 0 to 3, you have the center-based option. And then you also have the home-based option. The home-based option is really neat. Within that option, home visitors go into the homes once a week and work with the families, because as we know, the families are the primary educator of their children. And so within that home base, we just blossom off of that. And then the same thing with the STEP program. Those STEP teachers are assigned to families, and they work with the families, and they go into the homes and work with those families on an ongoing basis, and getting those expectant mothers ready to welcome that infant into the home, and then also work with that family to, once that infant is in the home, to make sure that that education of that child is one of the primary focuses for the family. Now, how do you get into Head Start? Head Start is an income-based program. Families have to be at or below the federal poverty guideline. We are able to take some over income children. We kind of leave those over income slots are reserved for children with disabilities. So again, we have the 0 to 36 for the early Head Start. Then we have the 3 to 5 for the Head Start. We also have some families that can be accepted into Head Start that are categorically eligible. That means if they're homeless, they're automatically eligible. If we have a family that's on TANF, they are automatically eligible. So meaning if we have slots available and we have families in those two categories, they automatically go to the top of that wait list and would get that position. Also, they must be, and I have a typo and I just caught that, I just came from Travis County, I didn't fix that, but they must be a resident of Tarrant County in order to be enrolled in the program. So this program is exclusively for Tarrant County. And so we have sites all over Fort Worth. And the next, I'm going to kind of show you the different locations that we have. And let me go to the next slide, because it kind of shows a kind of a map of all those different locations. So as you can see, we are all over Tarrant County. And then if there is not a center near you, we do have that home-based option for the early Head Start. Currently, we have several sites that we are still currently enrolling for. So if you know of any kids out there that are not in school, we do have some openings at some of our locations. One of the neat things about our program is we know we do have that they must be 3 by September 1 in order to go to the school district. That is not necessarily the case with Head Start. If there are no other children to enroll on our wait list and a child has turned 3 after September 1st, we can enroll that child. So, you know, there's a lot there's that group of kids that are sometimes left out. So we can serve that underserved population that turned 3 after September the 1st. They don't necessarily have to wait a whole nother program year to get services. So that's a quick overview of kind of what it takes to get in and where we're at within Head Start. Now go back to one of the things the moderator said. When you are looking for child development, you want to make sure that you are enrolled in, your child is enrolled in a high quality program. Well, that's one of the things CCA offers with our Head Start program. It is truly a high quality program. We have a scientific curriculum that we use. All of our teachers are assigned mentor coaches that work with them on a daily basis. We also ensure that our teachers have the correct teaching credentials to work with the age groups that they work with, meaning if they're in our early Head Start program, they have at least infant and toddler CDA. If they're in the Head Start program, our goal is to work with them and make sure that they have a degree, something related to early childhood. And then again, not only with that, our kids are assessed on a regular basis. We use teaching strategist goals to assess our students, but then we kind of take that a step further and we also use class to assess our teachers. So our teachers are being assessed as well as the students are being a success. I tell people all the time, you can't truly hold a student accountable to their test scores if you're not making sure that they have a teacher that is delivering high quality education. And so we use that when we are monitoring our teachers with the class to make sure that those TSG scores of the kids reflect the teaching ability of the teacher. So that's just kind of some of the things that we do to ensure that we have a high quality program here at CCA.
Thank you, Patrick, for providing that overview of early Head Start and Head Start at CCA. Could you tell us what is the enrollment process for a parent looking to get their child enrolled in one of your early Head Starts or Head Starts programs?
There's a couple ways that families can get enrolled. They can actually call the CCA main office, and we have enrollment clerks that will get on the phone and work with them immediately through that process. They can also go to our website, childcareassociates.org, and enroll through the website, or they can simply walk into one of our centers anywhere within Tarrant County and say, hey, I want to enroll my child. Even if that site does not have an opening, they will still work with that parent, fill out the application and figure out what center may be closest with an opening. So like I said, they have a couple of different options: walking in, going online, or simply calling CCA's main office, and they will connect them with the eligibility specialist that will take their information and walk them through that process.
Yes, and one thing you mentioned, high quality, which we're all a fan of. In early Head Start and Head Start is known for providing high quality. And one of those high quality measures that you guys perform is your support systems. Like you guys have support systems for the parents, and not only the children, but the parents. Could you tell us about some of those different support systems that you provide for children and parents at early Head Start and Head Start?
One of the things that Head Start prides itself on, and one of the foundations of Head Start, is not just parent involvement, but parent engagement. We want to truly make sure that the families are engaged within the program, and we do that a number of different ways. One of the simple ways that we do it, each week, we pick a different parent to look at our lesson plan and just kind of go through that lesson plan with the parent, review that lesson plan, explain to them what we're going to be doing in the classroom for that week. And that way we can kind of, get a parent's perspective of, hey, maybe this is not good for the kids, or maybe it is, but the parents are involved within that. All of our families receive 2 home visits. We're not doing the home visits to kind of go in and see if their house is clean or anything like that, but we're doing that so that we can do the home visits, so that we can go in and kind of gauge the type of environment the child may have come from. And that way, when we're in the classroom, it kind of gives us some different pointers when we're working with the kids. We also have a thing called parent committee meetings, where we have those meetings once a month at all of our sites, where the parents can kind of come together, talk about different issues that they may have at the site. And then we also use those times to offer bring in different presenters. This coming next month, we're going to have TWC, and we're going to have somebody coming in doing budgeting workshops. And then we also offer parenting classes. And then we also have an app called Ready Rosie, where the parents can do different activities, different things like that with the students. So we just want to make sure that our families are truly engaged. And then one of the things that sets Head Start apart from many other programs, we have a thing that we call Policy Council. And on that Policy Council, it is made up of parents, and all of our policies, procedures, our budget, hirings, firings, all of that type of thing has to go before that Policy Council. So everything that we do, the parents are involved in it. The parents have a say in what we're doing and how we're doing. Even if we cannot even change the curriculum without going through the parents and making sure that we have a buy-in from them.
Thank you so much for sharing that. And as you guys can see, early Head Start and Head Start is so important and is a value component of our community. Thank you, Early Head Start and Head Start CCA, for the wonderful work that you're doing for children in the Tarrant County area. Next, we have Lenny Donnelly and Tanya Swindle from Tarrant County CCMS. Lenny and Tanya, CCMS, CCA is great friends and partners with our organization, ADFW Family Childcare Network. And thank you guys so much for the awesome work that you guys are doing on behalf of parents and children in the Tarrant County area. And you guys, when you're ready, you have the floor.
Okay, well, I'll go first. And I'll tell you a little bit about the eligibility for Tarrant County CCMS. Our program, we are managed by Childcare Associates, and which has a contract with the Workforce Development Board. CCMS provides subsidized childcare to families in Tarrant County, Texas. The eligibility for a household is 25 hours of work and or school a week. If it's a 2-parent household, each parent must be doing 25 hours of some type of activity, either work or school. They must meet our income guidelines, which is 85% state median income. And parents have a choice of any childcare facility that they would like their children to attend. Our website is tarrantcountyccms.org. And if you go there, you will be able to apply for a wait list, make any type of change requests, transfer request, and also upload any type of eligibility forms to a secure site. With the state of Texas going through COVID for the last 18 months, it's been really hard on businesses. So with money that's been made available for a SIRP program, which is a Service Industry Recovery Program, and that helps businesses and their employees find childcare. This is for 3 specific groups, and all of this is listed on our website, a link on our website. But the sites are arts, entertainment, and recreation, accommodation and food service, and retail trade. To qualify for the SIR program, parents just need to go on our website. There's a link there for the SIR program and apply. Basically, the only thing that they have to provide us with would be their most recent check stub, showing that they are in employment with a service industry employer, and that we need to have a birth certificate of every child who is receiving childcare. Once we get that and determine them eligible, they have childcare for a year. That's one of the major benefits that's going on right now for businesses trying to get employees and hire employees, because a lot of them are stating that they don't have childcare. So with this, they'll be able to have childcare and be able to work as well. Speaking of our wait list, when we do pull up off our wait list, we have priority groups that we pull from first. And those groups are veterans, homeless, children with disabilities, teen parents, military deployed, and former foster youth. We always pull these clients off first because they are a priority. After that, we pull our low-income clients. We have pulled the last about 3 months, we pulled 1,000 families a month to offer them an opportunity for enrollment for childcare. Basically, that's it for the eligibility side of it. Any questions?
There was one question that was asked in the chat box. I wanted to make sure that you were aware of. It does say that it was asking, what is the waiting list? And is it the same as the regular CCMS assistance?
The CCMS wait list is totally different than the SIR wait list.
Okay.
So there's 2 different links there. And
okay.
They think that they are in one. And once they go to our website and click one of those links, they will see if the job that they are currently at, if it meets the requirements for a SIR program or a SIR employee. And then we have our regular CCMS wait list as well.
Okay, and thank you for that. There was another question. What if you don't have a job because of COVID-19?
Okay, you can still apply for our wait list. Currently, we are allowed to make, if we pull you from the wait list and you're not working, you can get 3 months of eligibility for childcare. After that 3 months, you would need to show compliance, 20 to 25 hours, the regular qualifications for the program. But this is the first time we've been allowed to put clients on initially without a job.
So Linus works with the eligibility of approving parents off the wait list. And I also work for CCMS, and I work with the childcare centers, and we work with everything quality. Deciding who will take care of your child while you're working or in school can be a hard job. And you want to make sure that you're finding a safe and a happy place that you can leave your child. And it's going to be one of the biggest decisions you can make. Jerletha did speak a little bit earlier about regulated childcare, and I listed those different kinds of childcares that are regulated, that do work with our CCMS eligibility. Licensed childcare centers, those are going to be your big centers, your Little Tykes and Kinder Cares, mom and pop childcare centers, many classrooms in each in those centers. And then we have licensed childcare homes. They can have up to, I think it is 12 children. It depends on those smaller children, your ratio is going to be a little bit smaller. And then you also have registered childcare homes. And we work with all 3 of those with CCMS, and we work with them in the Texas Rising Star program. We also do work with listed family homes, and that's just for relative care. If you have a relative that could care for your child, I know you do have to live in separate households. And you cannot be part of our Texas Rising Star program, but we can provide subsidized care for a relative not living in the same household. So relative care is not regulated by licensing. So licensing isn't popping in on them, checking those minimum standards that Jerletha referred to earlier. This is just kind of a screenshot of what the licensing website looks like. I've listed the website. This is a good place for you to go and search childcare centers and look at their deficiencies. You can learn a lot about a childcare center by searching them in licensing, seeing how long they've been in business, seeing how many deficiencies, see if they're following. Remember, licensing is just minimum standards. So this is just the minimum. And so this is a good place to start when you're looking for childcare. So Texas Rising Star and many of these other accreditations, if a childcare center has, or it could be a home, could choose to go above the minimum standards and be accredited. We have many like NACI centers, NEPCA, the National Association of Family Child Care Accreditation. These childcare centers that have chosen to go above the minimum standards could have one of these accreditations. And what I'm going to talk about a little bit is Texas Rising Star accreditation. It's the state accreditation for Texas. Most states do have a QRIS system, which is a quality rating improvement system. And Texas Rising Star is Texas's accreditation. Research does show that caregiver education, caregiver training, group size, staff to child ratio, daily learning activities, and program environment have a positive impact on child's social, emotional, physical language, and cognitive development. You can find Texas Rising Star website at www.texasrisingstar.org. Right now, it used to pull up a list of childcare that are Texas Rising Star, but now it's linked to the Texas Childcare Availability Portal. This is a place for parents to go in. You can put your address, ages of your children, and childcare will appear. There is also a search for them for the Texas Rising Star. It shows what kind of star level they are. Texas Rising Star is going through another change. They go through changes every 5 years. And so we're in the process of implementing the new guidelines for Texas Rising Star. And that comes down from TWC, Texas Workforce Commission. We focus on teacher-child interactions. We focus on the education of the caregivers and the director. We look at the indoor and the outdoor environment. And now we're starting to look at the program administration. Patrick has spoken about family involvement and participation, and we look at that. We look at curriculum. We look at anything to do with the child care center that can make it better. Ratios, the language that's going on in the classroom, the interactions inside, outdoors, and that they have a nice environment so that they can develop where they need to. And so after so where I'm at now is that we're in the process of implementing those new Texas Rising Star guidelines, and we'll be going through many assessments, and you can be part of this program. If you hold a CCMS financial agreement to care for subsidized children, and then with all that, you receive resources, you receive coaching. So somebody is out there in those childcare centers a lot from our office, helping those teachers interact with those children appropriately. So I just also wanted to lead off with that. Remember that 80% of the brain development occurs before age 4. So it's important that you continue to stay involved with your children's childcare. By staying involved, you will greatly increase the chances that your child will get the highest level of care possible. which matters a lot during the critical period of brain development. And remember when thinking about being involved in your child care. And you can always find more resources and learn more about Texas Rising Star at texasrisingstar.org.
Thank you, Linus and Tanya, for providing an excellent overview of CCMS financial assistance, the different types of childcare, and Texas Rising Star programs. I have questions for both of you. Okay, question number one is for Linus. What is the biggest barrier to getting CCMS assistance for a parent?
Okay, the biggest barrier
Yes.
for childcare assistance?
No, like what is the biggest barrier like parents will run into for obtaining childcare assistance? But you know, to be honest with you, as a parent myself, one of my biggest barriers, I was in between jobs and I really needed childcare to look for a job. So I'm so excited to hear that now parents can get on assistance without having a job while they're kind of looking for a job.
Right,
So,
right. That's one of the main things that we've heard throughout the years, that I can't get a job unless I have childcare. With this availability of this right now, it's really helping out a lot of parents to be able to find a job and sustain it so that they can get the remainder of a year of childcare. Barrier that some of my clients are seeing right now that we're pulling off of the wait list is, you know, and we know it is based on COVID, the availability of slots for the children. So we're starting to see that a little bit as well. But right now, with so much money out there, I mean, you can receive childcare if you meet any of these levels of qualifications.
Yes, you can. And thank you guys for providing this very much needed assistance to parents in Tarrant County. Tanya, has there been any changes in the number of Texas Rising Star providers since COVID-19? And are there spaces available to become a Texas Rising Star provider? And how can one become a Texas Rising Star provider? I know that's a loaded question, but I know you.
Yeah, that's a lot of questions. And it's after 5 o'clock. So yes, unfortunately, we have seen a decline in our Texas Rising Star sites. In March, we were at about 210 childcare centers that are Texas Rising Star. And unfortunately, probably at the end of this month, we're going to be at 190. We've lost many to closing their doors, many that they just didn't have the enrollment to keep it going. And so they're slowly closing their doors, unfortunately. So there is available slots. I spoke earlier about the Texas Childcare Availability Portal. That's going to be your best shot to try and find childcare in your area with the ages that that you are needing care for. So that's going to be your best shot on finding childcare. And your next question was how to become a Texas Rising Star. So we are in the process of becoming or going through our new guidelines. So right now we're on a freeze. So I'm hoping that in the next couple months we will start assessing, and then we'll be able to start adding more Texas Rising Star providers. We desperately need them as we have dropped so many in the last few months due to COVID. So we do plan on ramping that back up and getting some more quality childcare providers out there for our parents to take their children to.
Yeah. Now there was one more question that popped up in the chat box. This is for Linus. How long is the waiting list to get childcare assistance? Or is there a waiting list right now?
Yes, there is a wait list. Normally I tell, it's kind of fluid, but normally I can tell people it can be anywhere from 6 months to a year, depending on right now what wait list you get on, especially for our low income clients who are not one of the priority groups. It can be anywhere from 6 months to a year. But like I said, if you qualify for the SIR program, by all means, go and apply for that wait list. It moves a little faster.
Yes. Now, what is a website where we can find to get on assistance and how we can find out more about the Texas Rising Star program? Can you guys provide us your website address?
Yes, our website address is tarrantcountyccms.org.
Mhm.
And you can learn more about Texas Rising Star on our CCMS website. And you can also look at www.texasrisingstar.org.
Yes. Thank you, ladies. You guys provided excellent information for our community. Next,
Thank you.
we have my great friend and colleague, Faith Rivera, Community Alignment Coordinator with Help Me Grow North Texas. Faith will provide information on the services and supports available for our early childhood intervention and Help Me Grow.
Hello, everyone. Thank you so much, Elaine, for the invitation to be a part of this event tonight. Hi, everyone. Like I said, like Dorley said, my name is Faith Rivera, and I work for the Help Me Grow North Texas program. And I don't have a presentation tonight, a PowerPoint, but I did want to show you guys our website and just briefly talk about the free services that we offer to families in the community. So Help Me Grow North Texas has been around for about 2 years. We serve 18 counties across North Texas. So I guarantee all of you on this call will be able to be in one of our 18 counties. But really what we focus on is support for families with children under the age of 8. We offer developmental screenings for families to make sure that their children are on track for school, help celebrate any kind of strengths and milestones that those children are meeting. And if there are needs that your child has, to be able to get connected to resources, we're there to support you. So we have this one phone number that you can see on the screen, 844-NTX-KIDS. And when you call this number, you'll be connected with a family navigator. And what the family navigator does is really get to understand you and your family and where you're at. They'll offer the free developmental screening, just like I said, to see where your child is at and help you as a parent be able to celebrate those strengths, and see if there are any resources in the community that your family could benefit from. It's always wonderful being a part of presentations with other community providers, such as the ones that are on the call today, and many of which are providers that are listed within our data system that family navigators can get you connected with. Our family navigation team will work with families for about 3 to 6 months, really just getting at where your family's at, offering any kind of support that you may need, and then offering follow-up to make sure that your needs were successfully met and you were able to get connected with the resources that you need. Our services are free of charge to any family as long as there's at least one child under the age of 8 or the family is expecting and you live in our 18 county service area. A big focus of Help Me Grow North Texas is making sure that all children are on track developmentally. And the best way that we do that is through offering that free developmental screening to each and every family. So if you have a child that's in your house that's under the age of 3 and you receive a developmental screening, and the family navigator shares with you that there's potential for a significant delay, we are able to get you connected with the early childhood intervention program that is operated through MHMR of Tarrant County if you live in one of those 12 service area counties. And that is a service that really focuses on children with significant developmental delays or with certain medical diagnoses. So in the state of Texas, your child has to have at least a 25% delay in at least one area of development in order to qualify. And so the beautiful thing about working with our family navigators is they help you figure out what's best for you. So maybe it is ECI, maybe it's other programs, but they're going to walk alongside you to make sure that you're able to get connected with anything that you and your family need, whether it's childcare, help with assistance of applying to programs, navigating the sites that you heard about today, getting behavioral support for your child, whatever you need to be able to best support your little one as they're learning, growing, and getting ready for school. That's really what our family navigators focus on. So if you go to our website, www.helpmegrownorthtexas.org, and you scroll down right under the cute picture of the baby is a big button that says connect with the family navigator. This brings up a little survey. It's just going to ask you a few questions about you and your kiddos to be able to allow our family navigators to know some information about you so that when they give you a call, they're best able to offer the support. You're also welcome to call at any point directly to that line, the 844-689-5437 line. And if it's during business hours of 8 to 6, Monday through Friday, you should get one of our family navigators live. If it's outside of those times, or if you fill out the survey, then the navigators will give you a call normally within 1 to 2 business days. And really the goal of Help Me Grow North Texas is to make sure that every child in our community and their family has access to the resources that they need, the support that they need, and that we're able to see all children able to develop properly in a healthy manner and that they're ready for school. So that is it for me.
Thank you so much, Faye, for the information that you just shared with us. Now, I have a question for you. Who should be the first point of contact for a parent with concerns about a child's delay of development? Like, who should they contact?
That is a great question, Derlitha. So right now, all non-medical referrals that are coming into the ECI program for basically the 12 counties west of 360, so Tarrant kind of over, all of those referrals are actually coming in to Help Me Grow North Texas. So if you have any kind of concern about your child, you have any kind of question, the best place to go would be to Help Me Grow North Texas. You can either go to the website that I showed you or call the number directly. Because even if you go directly to the ECI line, they're going to transfer you to Help Me Grow. And the reason why that is happening is we found that developmental screening was really the best way for families to figure out if ECI was the best program for them, because there are such strict eligibility requirements in the state of Texas. And doing that developmental screening first ensures that the families that do end up needing a referral are able to get in quicker to receive the services that they need.
Yes, and thank you for all the resources and that you guys are providing to our community, and not just our community and parents, to actual service providers, childcare practitioners across not just the Dallas-Fort Worth Metroplex, but all the other counties that you guys are touching. So thank you so much for the services that you are providing for us. Now that we have heard about childcare and related topics, we will now move on to Michelle Cummings with the WIC program director to get information about WIC and how it helps moms and dads, caregivers of young children. Michelle, you have the floor.
My name is Michelle Cummings. I'm a registered dietitian and I'm the director for the WIC program. Thank you so much for letting me come and talk to you about the WIC program. I will go as fast as I can because I know that we're almost out of time. So what is WIC? WIC, it stands for Women, Infants, and Children. We give families the services, support, and inspiration they need to eat right, have a healthy pregnancy, breastfeed successfully, and raise amazing kids. So the services that we offer are nutrition assessment and counseling, nutrition education classes, breastfeeding support and breast pumps, and referrals to other social services. So every one of these programs that have talked tonight, we are referring our participants to these programs. We also provide supplemental nutritious foods. So who can apply? Pregnant women, postpartum women, infants, children less than 5 years of age, and custodial fathers, grandparents, and foster parents can also apply for the children and the infants that they are caring for. What does it take to qualify? We have to have proof of residence. You have to only live in the state of Texas, and citizenship is not a requirement. We also have to have proof of income or participation in a gateway program. So our guidelines are gross income must be at or below 185% poverty level. And the gateway programs that qualify for, that automatically qualify for WIC are Medicaid, TANF, and SNAP benefits. determination of, and the other requirement is that we have to have a risk condition. And we do that by nutrition screening, which can be a medical or diet-related nutrition risk. Nutrition education. This is probably one of the most critical parts of every appointment that our participants come to. It focuses on what the families are most interested in learning about. And it is done by as individual counseling through facilitated group discussions, self-paced modules in the clinics, online or at a local library. The pregnant women and breastfeeding mothers meet with qualified breastfeeding peer counselors, and women who are breastfeeding are eligible for assistance with manual or electric breast pumps. This is just a list of the nutritious foods that we provide. I listed the infants because if a mother is exclusively breastfeeding, the infant is not going to need any formula because the mom is providing that. So the food package in that instance is for the mother who is breastfeeding. So we also offer special dietary food packages. And so this is a list of those food packages. And so I wanted to list a little bit of data and talk about why WIC matters. WIC is a federal program, and there are a lot of studies because we're a nutrition education program and provide supplemental foods. There's a lot of studies going on in WIC with USDA and other providers. So with why WIC matters for deliveries, WIC moms who are on the program have longer pregnancies. They have fewer premature births. They have lower incidence of moderately low to very low birth weight infants, and they increase the likelihood of receiving prenatal care when women participate in the WIC program. Also, for our kids, studies show that compared to other cash income SNAP benefits, WIC is more effective at improving preschoolers' intake of key nutrients. There's something called a healthy eating index, and these values are higher among 1 to 2 year olds that are participating in the WIC program. And kids that participate in the WIC program have a decline in iron deficiency anemia. It's a big deal. In breastfeeding, since 1998, breastfeeding initiation rates among WIC participants have increased 30%. Over the last 2 decades, WIC has more than doubled breastfeeding rates at 12 months of age.
Wow.
Interconception health. Women who participate in WIC during a postpartum period of 1 pregnancy showed improved hemoglobin levels and lower risk for maternal obesity at the onset of subsequent pregnancies. So this is just, now I want to talk a little bit about COVID. During COVID, we have had to modify our processes. So USDA has provided a waiver for us where we are able to serve our participants over the phone. They don't have to come into the clinics to be weighed and measured and their iron checked right now. And so we're doing everything over the phone. Participants have a portal where they can upload all of their documentation and complete all of the health questionnaires. And also the cash value benefits for their fruits and vegetables has increased from $9 per person over 1 year of age to $35 per person for fruits and vegetables. Like I said, we're operating a drop box process, and we now have a WIC shopping app. that helps our participants shop. It's easier to shop. It's easier to find the WIC foods now. And then coming soon, we're going to be able to let our WIC participants schedule their own appointments, and they will be able to have us call them back if the phone lines are long when they call for an appointment. This is just our outreach flyers that I hope everyone will get. I wanted to point out that the clinics that are listed here, there are stars next to the ones that are open. We combined clinics during COVID so we could operate more effectively during our Dropbox process. And then this is another outreach flyer that just is for our partners and programs that talk about income eligibility. And then on the other side is the list of our WIC locations. And that's all I have. Thank you so much. This is one more thing. This is our Mythbusters, and this is usually something that we give out at our health fairs, and it just kind of talks about the facts that people misinterpret about the WIC program. Okay, now that's all I have. Thank you very much.
Thank you, Michelle. That was insightful to hear, and also important to share that you guys are still serving young families of young children during the pandemic, and how you came up with an innovative way to keep serving families to make sure they get the nutritional meals and formula that they need to make sure that their babies are safe and healthy. So thank you so much. And as you guys can see, we have a jam-packed hour with tons and lots of information for you guys. I just want to let you know we have one more session to go over, and this session is being recorded. So if you do have to leave, we do understand to be kind of considerate of your time. But like I said, the session will be recorded, and we're going to go on to our next presenter. Thank you so much. Our final panelist is Frances Wimpler with Cook's Children for Center for Children's Health. Frances is going to share with us a tool that can help locate food, housing, transportation, and other resources. Frances?
Thank you all so much for having me. This is actually my second presentation to give with you guys. If you were here last week, I'm hopefully going to give you some information that you didn't hear last week. But I am Frances Wampler. I am here at the Center for Children's Health. I work with Elaine, and my team focuses on adverse childhood experiences. And one of the projects that I'm the ambassador for is Text for Tarrant Cares. And Text for Tarrant Cares is an enhancement to the Tarrant Cares platform here in Tarrant County that pulls resources from 211 into their website. Text for Tarrant Cares is the enhancement to that platform where you can actually text and interact with Tarrant Cares via your smartphone. We worked with community partners to develop this application, and it actually launched in April of this year, so it's relatively new. So hopefully I'm giving you all some really good information that you can go and share with others. Some of the resources that are offered on our platform are things like food and clothing, rent and utility assistance, mental health and counseling services, family support, early childhood care services, substance abuse, child abuse and neglect services, and many other critical needs. I'm going to go ahead and give you a demonstration. If you have a smartphone handy, you're welcome to follow along with me and then ask questions as we go through. If you're using your smartphone right now, you may not be able to do that, but definitely follow along if you can. So this is a screenshot of my phone that I took whenever I was doing this. So the first thing you're going to do is text the word find to 67629. And that is our dedicated short code for Text for Tarrant Cares. It's going to text you back immediately and ask you what your language preference is. You'll press 1 for English, 2 for Spanish, and then it'll send you a welcome text. It will also give you an indication that if this is a life-threatening emergency, please call 911. Text for Tarrant Cares is not a live person that you're speaking with. So if it is an emergency, we do encourage you to call 911. Or if you need to talk with somebody, maybe it's not an emergency, but you need a little bit more help and would like to talk to someone, we always recommend calling 211. So once you click on that link that you saw on the previous screen, it's going to take your smartphone to this screen. And all of the next few slides that you're going to see are screenshots from my phone. Hopefully you'll be able to see them really well on the presentation, but I wanted to give you guys a really good idea of what it would look like once you get to the guided search. So the first slide that you're going to see here, it's going to ask you for your zip code. That way you can find the resources that are the closest to you. You can also adjust the radius. So you can adjust this from 25 to 5 to 10. So you can search close to your home. And if you don't find anything, maybe if you chose like 5 miles and you don't find much, you can come back to that first screen and adjust the radius and maybe look for something out a little bit further. We always recommend that you find what's closest to you. So make sure that that radius is set to the lowest setting whenever you're filling out the guided search. These next 9 questions are automatically going to default to no. So it's going to ask you a question. Are you interested in food, clothing, or housing services? And that little bubble is going to say no. If you're not interested in any of those services, you can just hit the next button at the bottom. But if you are, you're going to change that to yes, and then it will give you all of these options below. It says, if yes, select all that apply. If all of these apply to you, select all of them. Maybe only a couple of them do. For me, just for this demonstration, I clicked just a few, and I want to show you what it looks like once you get through there. So you'll click on all the items that are relevant to the search that you're looking for. These next couple of slides are just the questions. I just wanted to walk through it with you so that you knew what it looked like. The one on the left is question 3, and it's about mental health and counseling services. And those are some of the options that are available. You'll see the question there on the right as well. Again, if none of these pertain to the search that you're looking for, it'll default to no, and you can just leave it at no and just click through the questions. All right, question number 5. Are you interested in family support services? Again, same thing. 6, early childhood services. You'll see here Head Start, which we've been talking about tonight, early intervention for children with disabilities. So this is going to be programs like ECI, early literacy development programs, Head Start, and play therapy. On the left, you'll see substance abuse programs. There's several more options. So when I took my screenshot, it wouldn't let me get all of it. So I got as much as I could. And then on the right is domestic violence services. That's question 8. Question 9 is child and abuse and neglect services. And then question 10 is employment services. So once you've selected all of your interests and filled out all the questions, you're going to see your search results. And each of those questions is going to be labeled in these kind of darker areas. See where it says food and clothing and household. And then in parentheses, it says 25. That means that there are 25 options available under food and clothing and household, and 1 available for housing. You can do multiple searches. So at the top, you'll see like name this search. You can always name the search. So maybe you came through the first time and you were just looking for food and clothing. So you can name that search food and clothing and then come back to it later. That way you don't have to click through all the questions. Just make sure you hit the save results button before you go on to the next screen. All right. So what I did here is I just zoomed in a little bit on my screen and took these pictures. Again, in parentheses is the number of resources available. If you click on that on your smartphone, where it says food, clothing, and household, it's going to open up and you're going to see all of these other options. For rent payment assistance, there were 20 services available. Utility assistance, there was 1 service available, and for WIC, there was 4. I expanded these just so that you could see what it looks like when you open all of them. But as you can see, there's a lot of resources that pulled with just a few items that I selected on my search. And I was just clicking buttons. So, I think it turned out pretty good. When you click on the blue portion of these labels, like where it says WIC or utility assistance, on the right is when it opens that up. So if you're like, yes, I'm really interested in WIC, I want to know what the 4 resources are that are available, it's going to give you even more information. It'll have Tarrant County Public Health is the first one that popped up. It's going to tell you how far away from your zip code it is. It's going to give you the address. It'll give you more information about what that resource is. I know we just learned a lot about WIC, but if you didn't know anything about WIC, it'll give you a short little paragraph about what they offer. And then if you clicked on Tarrant County Public Health, it would just take you to their page and give you more information. You can also click the little plus sign. It'll give you their contact information so you can call them directly. When you're done with your search, if you go back to your text messaging, it's going to send you another just kind of automatic text to follow up with COVID-19 testing and vaccination information. If you are still not sure that you found what you were looking for, you can always come back to this screen as well and type find again, and it'll start you over from the beginning of the process, and you can do it again. You could also do that if you wanted to do another search and then save your search, and all of those search histories will be saved on the platform. And then I know I ran through that really fast because I'm trying to be mindful of time, but here's my contact information here at Cook Children's. I am happy to share this information with you or any of your partners, or if your families have more questions about this, we are happy to answer any questions that you have and share this information with you. I really hope that it was helpful.
Thank you, Francis. Thank you, Francis. Text for Cares is an excellent tool for families and young adults to use to find much needed services in the community. Will this tool be available in other languages at some point?
We are right now offering the search in English and Spanish. Those are the only 2 languages right now, just because that's the foundation of the Tarrant Cares website. But if they ever expand their languages, then we would work with them to expand ours as well.
Thank you so much. And thank you again to all our panelists for providing timely information to help families navigate their parenting journey in Tarrant County. We really do appreciate it. Now we're going to open up the floor for any questions that our participants may have for the panelists. If you have any questions, please drop them in the chat box and we will answer your question. But I'm going to turn it back over to Elaine. Thank you so much, Elaine, for having me being your moderator tonight. I really appreciate the opportunity, and I really appreciate engaging and meeting each panelist on the panel tonight. Thank you for having me.
Jalitha, thank you for agreeing to be the moderator, because I know that's not an easy task for a woman as busy as you, but I thank you so much for taking time out of your schedule. I really appreciate that. And I want to say thank you to our panelists today. Guys, what you do every day to work with the family, children, and the community in general is what I call superhero level of work, because it's one of those jobs that you will never totally get credit for, but you know it in the results that you see from the kids eventually. You know it from the changes in the parents' lives that you're able to see as those children progress from early Head Start to Head Start on into school. It's the increases in the reading and everything that they do, all those things that we need. And it's even on some levels, the growth of the program. But it takes all of us to embrace all things childcare, all things children, to ensure the success of not only those individuals, but our communities as well. And I just want to say thank you again for your time. And I want to say thank you to our participants too, because you've given some valuable time this afternoon to sit here for an hour and almost an hour and a half just to be a part of this conversation. So I don't know quite what drove you here today other than wanting the information, but to me, that says a lot about you and the path that you're on to get the information, the resources, and the knowledge that's available. Because a lot of times when people when you ask parents, what is it they need? They usually say community resources. So kudos to you for partaking of community resources that have been made available for you tonight. And I just want to say on that note, we had 2 more sessions that we were going to do as part of our series, but we're putting those on hold until 2022. But just know that we will continue. We hope that you all will continue to join with us next year as we move forward with the series about growing healthy kids. Thank you.